Imagine waking up one day and feeling that half of your face simply isn't responding as it should. Or perhaps, when trying to grasp a coffee mug, your hand seems to have forgotten how to do it. Situations like these can be the first signs of a silent and relentless adversary, stroke, also known as a cerebrovascular accident, CVA. This enemy doesn't choose age, gender, or social status, striking when least expected and leaving a trail of challenges in its wake. Today, we're going to explore 7 warning signs that your body gives indicating that a stroke may be on the horizon. More than symptoms, these are urgent messages that demand immediate attention. But how can we identify these signs in time? And what can we do to prevent this blow from affecting our health or that of our loved ones? Dive with us into this journey of knowledge, where we'll unravel the causes, treatments, and, most importantly, how to prevent a stroke, turning it into a defeated opponent before it even enters the stage. The first sign of a stroke that often goes unnoticed but is of paramount importance is sudden weakness or numbness in the face, arm, or leg, especially if limited to one side of the body. This symptom may emerge as a warning, often mild and mistaken for temporary fatigue or an improper sleeping position. However, in the eyes of medicine, it represents an interruption or significant decrease in blood flow to specific areas of the brain responsible for muscular and sensory control. This phenomenon occurs because the stroke, whether ischemic, caused by the obstruction of a blood vessel, or hemorrhagic, resulting from the rupture of a vessel, compromises the brain's ability to send signals to parts of the body. Rapid identification of this symptom and immediate seeking of medical attention are crucial. Timely treatment can not only save lives but also minimize permanent sequelae. For prevention, it is essential to maintain a healthy lifestyle, with a balanced diet, regular exercise, and control of risk factors such as hypertension and diabetes, key elements in the fight against stroke. The second sign that often precedes a stroke is sudden confusion, including difficulty speaking or understanding what others are saying. This symptom directly reflects the impact of stroke on the brain areas responsible for language skills, such as Broca's area and Wernicke's area. When these regions are affected, the individual may suddenly find themselves unable to formulate or process coherent sentences, a condition known as aphasia. The person may try to express themselves, but the words seem to escape or turn into a jumble of nonsense, both for the listener and the speaker. From a medical perspective, this abrupt change in communication ability is a red flag that demands immediate attention. It is a clear indicator that something is obstructing blood flow to critical areas of the brain responsible for language. Identifying and responding to this signal early significantly increases the chances of recovery and reduces the risk of permanent damage. Immediate treatment, often involving medications that dissolve clots or reduce pressure in the brain, can save vital brain functions. Preventing such occurrences begins with maintaining good cardiovascular health, controlling blood pressure, avoiding smoking, excessive alcohol consumption, and maintaining a healthy weight, simple yet effective measures to combat the threat of a stroke. If what I shared so far has resonated with you, I have something special that will interest you. Don't miss the opportunity to transform your life and start living your healthiest self today. By acquiring the ebook Secrets to Unshakable Health, you will have a guide with practical and proven strategies for living a longer, disease-free life. Click on the link in the first pinned comment and discover the path to lasting and robust health. The third warning sign of a stroke is sudden difficulty in seeing with one or both eyes. This symptom can range from blurred vision to sudden complete loss of vision, affecting one or both eyes. In practice, this can manifest when someone notices a curtain being lowered over part of the visual field or a total darkening, as if the lights were turned off. The brain and eyes work together to process visual information, and a stroke can disrupt this process, affecting the brain's ability to interpret what we see. The sudden loss of vision indicates that a stroke may be affecting the part of the brain responsible for vision, such as the occipital cortex. This sign is particularly alarming because it highlights an interruption in the blood supply to critical areas that manage our ability to see. Recognizing this symptom and seeking medical help immediately can be decisive for vision recovery and the prevention of more severe brain damage. Prevention involves care for cardiovascular health, controlling risk factors such as hypertension and diabetes, and adopting healthy lifestyle habits, which together form the first line of defense against stroke. The fourth sign that may indicate the imminent onset of a stroke is sudden difficulty walking or loss of coordination and balance. This symptom can manifest in various ways, such as unexpected dizziness, frequent stumbling without an apparent reason, or a sudden inability to control body movements precisely. Affected individuals may notice that their steps become shuffling or that they cannot keep themselves straight, even on flat and familiar surfaces. These difficulties indicate that the stroke is affecting brain regions responsible for coordination and balance, such as the cerebellum and regions of the brainstem. These areas are crucial for our ability to perform controlled movements and maintain posture. An interruption in blood flow to these regions can lead to the sudden loss of these skills, constituting a clear warning sign. Prompt recognition of these symptoms and seeking medical attention is essential to minimize the damage caused by the stroke. Preventing such symptoms, as well as others associated with stroke, involves adopting a healthy lifestyle, with an emphasis on regular physical activity, balanced nutrition, and control of medical conditions that increase the risk of stroke, such as high blood pressure and atrial fibrillation. The fifth alarming symptom of a stroke is sudden and severe headache, without apparent cause, often described as the worst headache of a person's life. This type of headache can be so intense and abrupt that it clearly differs from any common headache or migraine previously experienced. Individuals who suffer a stroke may report an overwhelming sensation, like thunder exploding in the head, accompanied, in some cases, by vomiting, dizziness, or changes in consciousness. A headache with such characteristics may indicate a hemorrhagic stroke, which occurs when a blood vessel within the brain ruptures, releasing blood into areas where it should not be. This type of stroke is less common than ischemic stroke, caused by a blockage, but it is extremely serious and requires immediate medical attention. The presence of extra blood in the brain increases pressure within the skull, causing intense pain. Prompt identification and seeking emergency treatment are crucial to reducing the risks of serious or fatal consequences. To avoid such situations, it is essential to maintain strict control over risk factors such as hypertension, excessive alcohol use, smoking, and obesity, as well as to seek regular medical care for monitoring conditions that may predispose to the risk of strokes. The sixth sign that may precede a stroke is sudden and unexplained sensation of nausea or vomiting. Although many people may not immediately associate these symptoms with a stroke, they can arise when the event is affecting areas of the brain responsible for controlling gastrointestinal functions. This symptom, especially when accompanied by other warning signs of a stroke, such as intense headache, weakness, or vision problems, should be treated as a medical emergency. Sudden nausea or vomiting, without a clear cause, such as food poisoning or a virus, may indicate that the brain is experiencing significant disruption in its normal functions. Understanding how these symptoms relate to a stroke involves recognizing that the brain coordinates a wide range of bodily activities, in addition to cognitive and motor functions. When a stroke occurs, blood supply to a part of the brain is interrupted, potentially affecting the area responsible for regulating sensations of nausea and vomiting. Prompt recognition of these signs and seeking medical help can be decisive in minimizing the impacts of the stroke. Prevention includes lifestyle measures such as maintaining a healthy diet, regularly exercising, avoiding smoking, and controlling chronic diseases such as diabetes and hypertension, which are known risk factors for stroke. The seventh and final sign that deserves immediate attention, as it may indicate the occurrence of a stroke, is sudden loss of consciousness or fainting. This extreme symptom occurs when blood supply to the brain is significantly reduced or interrupted, affecting essential brain functions. Loss of consciousness may be accompanied by a sudden fall, without warning, leading to injuries. In some cases, the individual may experience brief confusion or disorientation before losing consciousness. This alarming sign indicates that the brain is not receiving sufficient oxygen, a condition that requires urgent medical intervention to restore adequate blood flow and minimize brain damage. From a medical perspective, sudden loss of consciousness due to a stroke indicates the severity of the interruption of cerebral blood flow, whether due to a blockage, ischemic stroke, or bleeding, hemorrhagic stroke. Early detection and immediate treatment are critical for recovery and can significantly reduce the chances of permanent sequelae. Prevention strategies focus on controlling risk factors such as hypertension, high cholesterol, smoking, and obesity. Additionally, maintaining an active lifestyle and a balanced diet are essential for promoting cardiovascular health and, consequently, reducing the risk of strokes. Recognizing and acting upon the early warning signs can save lives and preserve quality of life. We have reached the end of our crucial journey through the 7 warning signs of a stroke, addressing their causes, treatments, and, most importantly, how we can prevent this life-changing event. Recognizing these symptoms in time and acting swiftly can not only save a life but also minimize long-term sequelae, preserving quality of life. We remind you that prevention is always the best path, and taking care of heart health is taking care of brain health. Stay active, eat healthily, and regularly monitor your health with qualified professionals. Your actions today can prevent emergencies tomorrow. If this video has brought you new information or important reminders, don't forget to like and share, so that more people can benefit from this vital information. And if you're not yet part of our community, subscribe to the Health Dose channel for more content that can make a difference in your health and well-being. Together, we can build a more informed and healthier community. Thank you for watching, and take good care of yourself.